Three big health discussions happening today at the CDC's ACIP meeting. This includes discussions about the hepatitis B vaccine, the dose given at birth, the MMRV vaccine, and the COVID-19 vaccine for kids. First, the hepatitis B dose. This protects babies right from the start. Mothers are screened for hepatitis B during their pregnancy, but some studies show that that only happens about 88% of the time, meaning that some people are not screened during their pregnancy. And gaps in screening, meaning somebody can have an infection but still test negative, means that some babies will still have a risk of being exposed. Prior to babies getting this dose of hepatitis B vaccine at birth, about 18,000 children a year were diagnosed with hepatitis B before the age of 10. Second is the MMRV vaccine. This is a combination vaccine for measles, mumps, rubella, and chickenpox. Some people worry that there is a risk of febrile seizures with this vaccine. What does the evidence tell us? It shows that about 1 in 3,000 kids could experience a febrile seizure if they receive MMRV as combination as their first dose if they get it under the age of 2. This is why a lot of practices, including mine, split them and give MMR as one injection and varicella or chickenpox as the other for their first dose if they're getting it under the age of 2. The evidence does not show that there is this risk for febrile seizures for the MMRV combined vaccine when kids get it as their second dose at age 4 or 5. And third, the COVID-19 vaccine in kids. In order to understand this discussion going on today about the COVID-19 vaccine, you have to understand the VAERS reporting system. VAERS stands for Vaccine Adverse Events Reporting System. VAERS is a way to screen the population for rarer side effects from vaccines. But anyone can report anything to VAERS, and just because it is reported does not mean that the vaccine is the cause of the adverse effect. It is a screening tool that we can use to look for patterns and to see if further studies are needed to decide if there is a link. As a pediatrician and a parent, I will be watching closely to make sure that children still have access to vaccines that protect them against dangerous infections.